Hi everyone. So today I'll be discussing about why a retainer is actually needed because I see most of the patients who've undergone a comprehensive orthodontic treatment and are reluctant in wearing a retainer after they have their active treatment completed. Now before we get into that, we need to understand the dynamics of tooth movement. By that I mean that what actually happens when any kind of force is applied onto the tooth surface. This, if understood by you, will help you to understand why is a retainer needed. So now coming back to our topic, before I'll discuss with what happens when you apply a tipping force. That means when you apply a force that is acting at just one point of the tooth surface, then that tipping force actually tips the tooth. That means it moves it by just tipping. That means applying a pinpoint pressure, because of which it bends at one side and comes out at another. So when a tipping force is applied, you see that a zone of compression is created on one side of the tooth, and the root portion that you see, that I've marked on the tooth also for you to understand. Now the crown portion will tip on one side and the root as a result will tip on the another side when you apply a tipping force. So obviously you have two zones of compression and you have two zones of tension. Where the bone is being compressed, the ligament is being compressed, is called as the compression zone, and where the ligament and the bone is being stretched, that's called a tension zone. So it's largely determined by the periodontal ligament. That means those ligament that are holding onto the tooth to the bone, those are called the periodontal ligament. All of this I've marked on the screen also, on the tooth also, and you can be seeing that on your screens. So this is what happens when you apply a tipping force. Then when you apply a force that is creating a bodily movement, that means the crown and the root, both of them are simultaneously moving in the similar direction, unlike when you were applying a tipping force. Then in that case, in case of bodily movement, you have one complete side, that is the resorption side, that means the compression side, wherein the bone is being removed and creating space for the tooth to come to that position. And another is the tension side, wherein the tension is being created, the ligaments are being pulled, which is why it is called as the tension side, and on that side new bone is being deposited. So this is what happens when a force that creates bodily movement is being exerted. Then when this is happening, on the tension side, the bone is being deposited. Now, how does the bone gets deposited? Obviously, it's not a procedure that can be done overnight. It takes months. That entire phase of remodeling, wherein the cells will come and the bone will get resorbed and a new bone will be formed by the osteoblasts. They'll lay down on that surface where the new bone formation has to happen, and then the mature osteoblasts, that is the osteocytes, they will come and they will lay down the minerals and finally complete the bone formation. So all this happens over a period of time, and this phase wherein all this is happening, some bone is being resorbed, some bone is being formed, that is called as the phase of remodeling, because obviously the bone around the tooth is being remodeled. Now here comes the requirement of a retainer. While all this is happening and while the tooth is being moved gradually, step by step, to the desired new position, the bone continuously keeps modeling and remodeling, and even after you have moved the tooth in its new position, bone remodeling is still happening around it. And it takes almost 6 to 12 months for it to get completely solidified and consolidated, I should say, not solidified, to completely consolidate in its new position. Now, to hold the tooth or the teeth in their new position while the phase of remodeling is being completed, and after it gets completed, then after all this, a retainer is removed. So, all this period, a retainer is required, and that is almost 6 to 12 months. In certain cases, like very notorious cases, you might need to have to wear it for 18 months or sometimes 24 months also, but that's very rare. Usually it's for 1 year. Now comes the point, if a retainer is not worn, then what happens? If a retainer is not worn for the time period that is prescribed by your dentist or your orthodontist, then in that case, a relapse is a definite thing to occur. You will start to square one. You will get back to square one from where you started, and it will be a mess again. So, a retainer is equally important. You can in no way think of skipping a retainer. That's it for now. Thank you.